Stronger than I once was, but I'm not talking push-ups. I'm doing this mentally so they don't banish me.
What up, YouTube? Survivalist News. We're over here on Twitter looking at a tweet from Alex Berenson, and this is just going to confirm what we knew all along. I don't know even why. I'm doing this video. It's pointless. We already knew this, but the CDC finally got caught. So it's worth it, I guess. As you sit home watching COVID death count spiral, please know the official CDC guidance for coding COVID-related deaths is as follows. Any death where the disease caused or is assumed to have caused or contributed to death, confirmed lab tests are not required. So we'll look at this from the National Vital Statistics System, and this from the CDC. Alert number 2, COVID-19, March 24th. New ICD code introduced for COVID-19 death. This email is to alert you that a newly introduced ICD code has been implemented to accurately capture mortality data for coronavirus disease COVID-19 on death certificates. Please read carefully and forward this email to the state statistical staff in your office who are involved in the preparation of mortality data. Send it to the state for preparation of mortality data. That gets important down here in a second. As well as others who may receive questions when the data are released. Okay, that's just talking about the codes, how they'll classify the deaths. That's not anything I want to get into. When will it be implemented? Immediately. Will COVID-19 be the underlying cause? The underlying cause depends upon what and where conditions are reported on a death certificate. However, the rules for coding and selection of the underlying cause of death are expected to result in COVID-19 being the underlying cause more often than not. Yeah, it's putting it out there. It don't matter. A lot of these people probably ain't even been tested. But it's still the expected result, COVID-19. That one's not important. Okay, what happens if the terms reported on the death certificate indicate uncertainty? If the death certificate reports terms such as probable COVID-19 or likely COVID-19, these terms would be assigned the new ICD code, which would be what this letter is supposed to be about. Okay, but anyway, these terms would be assigned the new ICD code. It is not likely the NCHS will follow up on these cases. Would never imagine. If pending COVID-19 testing is reported on the death certificate, this would be considered a pending record. In this scenario, NCHS would expect to receive an updated record since the code will likely result in R99 in this case. NCHS will ask the states to follow up to verify the test results, confirm that the descendant had COVID-19. Okay, so once again, they're going to send it to the state to confirm COVID-19. They're sending it to the state. Who's doing this? The states. They're all in on it. Every single one's in on it. And it's terrible that the health providers are even in on it. I mean, they're supposed to be there for our good, but, of course, they're not. Do I need to... no, I don't care about that. Should COVID-19 be reported on death certificate only with confirmed test? Here we go. COVID-19 should be reported on the death certificate for all descendants where the disease caused or is assumed to have caused or contributed to death. Okay, let me read that again. COVID-19 should be reported on the death certificate for all descendants where the disease caused or is assumed to have caused or contributed to death. So, like I said, everything we knew all along, they finally got caught, making us not conspiracy theorists again, but, we're right. Let me go ahead and say it. People can call us stupid, they think, oh, my TV box said different. Whatever. Certifiers should include as much detail as possible based on their knowledge of the case, medical records, laboratory testing, etc. If the descendant had other chronic conditions such as COPD or asthma, that may have contributed. These conditions can be reported in Part 2. See attachment. Okay, that's just more nonsense right there about they're going to call COPD, asthma, anything else. They're going to send it to the state, get it certified as a COVID-19 death. There you see Stephen Schwartz, PhD, Hyattsville, Maryland, National Center for Health Statistics. Well, just wanted to confirm what we all knew. Take it easy. See you later, YouTube.